Hello, welcome everybody. Welcome to our second session in our spring online My HCPC Standards webinars. This afternoon we're going to look at Registrants Mental Health, which is the second one in our series. So we're delighted to be for you to join us today. There's a large number of people on the call, but I'm also joined by three experts in the area of Registrants, mental health and wellbeing, joined by Laurence, Justin and Carrie, who I'll introduce in a little bit more depth as we go along, if that's okay. But we're really looking in this 45-minute session, looking at how our HCPC standards of proficiency have increased our emphasis on registrants looking after our own mental health. And that's what we're really going to look at today. And it's about recognising that we're all humans, we're all human beings, and we need to remember to look after ourselves. Now, there's a lot of wealth of knowledge and experience with the people on the call, I'm sure, the people on the webinar today. So in a bit, we're going to be asking you to share your wellbeing tips and your strategies for maintaining and looking after your own wellbeing and that of your employees. So do bear that in mind. In a second, we'll ask you to look at that if that's okay. So a little bit of housekeeping just for today, really. So sorry we've had to disable your microphones and your cameras. I'm really sorry about that. I'd love to be having this conversation in person with you. With such a large number of people on the call, it's practically impossible to do that. So we will be using the Q&A function here right at the top of your screen on Teams for you to engage with us today. We might not be able to answer all your questions, but we will definitely answer as many as we can. We'll publish some of those for other people to see as well. But behind the scenes, my colleagues are answering lots of questions in Q&A. As we say, if we don't get to your question or your concern, then please, we'll be giving you information about how to send in questions at the end of the event, so no problem at all. Any technical difficulties, please do put those in Q&A and we'll help you with those as well. This event is being recorded, so that's great. But for everybody who might be watching this recording at a later date, obviously you can't ask us questions on Q&A, but you definitely can contact us if you need to, and we'll have our contact details at the end of the event with any questions or concerns. And at the end of today, we'll ask you to do our usual evaluation form, which gives us a massive amount of data about things that we can improve for our session. So, before I start, there's a couple of announcements from the HCPC I just wanted to share with you today. Yesterday, we launched our student competition. So if anybody knows any students out there, or indeed if there's any students on the call, our 2023 student competition is open. And actually, it's about designing a learning session on health and wellbeing for other students. So it's very, very topical. Given what we're talking about today. So last year's winners are on our website. They looked at the duty of candour, so do have a look at those, but I just thought that might be a really good opportunity to mention that to you today. And also, we're currently doing some consultations. Now, we're talking today about the review of the standards of proficiency, but at the moment this year, we're also reviewing the standards of conduct, performance and ethics. So if you want to get involved in some of our consultation events, you are really welcome. Just pop your phone up to the screen and grab that QR, but also there's stacks of information on our website about it. So do join us if you'd like to. So what are we going to cover in our session today? Well, I hope that you'll enjoy it. We're going to look specifically about what our new standards say about registrants' mental health. We're going to look at the words and what those words actually mean. We're going to share, I've already mentioned to you, we're going to share ideas that focus on wellbeing, and I'm asking you if you could share your thoughts and ideas about wellbeing strategies. I'm going to talk about what the HCPC can support you in this area, but also what my colleagues can bring to the table as well. So I hope that you'll find it interesting. So this is where we are with the 5 key changes in our standards of proficiency. The last one, centralising the service user, is available on YouTube. And after this session, we'll send you a follow-up email, which will have all the links for the session, and it will include the links for our previous webinar as well. And there are 3 others after this that we'll talk about later on, but we're looking specifically about registrants' mental health. So in my role as a professional liaison advisor, I should have said my name's Kim Tolley. I work as a professional liaison advisor for the Health and Care Professionals Council. But in my role as going around and talking to registrants from the Health and Care Professionals Council, these are some of the myths that I pick up about the updated standards. These are things that you might be worried about. And hopefully by the end of the session, we can demystify some of these things. So you might be worried if you're feeling anxious and depressed, and do you need to self-refer to the HCPC? Is that something that you need to do? You might be worried that the HCPC asks for proof that you've met those updated standards. And indeed, if you are called for a CPD audit when you renew your registration, will you have to meet all the new standards of proficiency? So we'll talk about those as we go along, if that's okay. Hopefully I will have busted some of those myths. So This is what the previous standards, the previous standards actually were much less about the registrant and their health and more focused on fitness to practice. And so our standards now reflect our position as a compassionate regulator and our real understanding here at the HCPC of the centrality really of registrants' wellness to practicing safely and effectively. So let's look at actually what they say. So here on this chart here, standard 3.2 in the standard proficiency. Now, our current standards say we must understand the importance of maintaining our own health. Now, that's absolutely right. But in the updated standards, that's expanded on quite a lot. And it talks about understanding the importance of our own mental and physical health and wellbeing strategies in maintaining fitness to practice. So we really emphasise the importance of registrants looking after their own mental and physical health. All right, we weren't very specific about that before, and we've talked a little bit about seeking help as necessary when we need to. Now, I think we all knew that. I certainly feel as a registrant, I knew that. But the interesting thing is, I think we've made it much clearer in our standards and guidance, right? So that's really important. So the new emphasis aims to make us feel as registrants that we're empowered to assess our own levels of health and seek support when it's needed. And in fact, we're actually obliged to do that, right? So the next standard, 3.4, now, actually, we didn't really have anything written in our current standards about this one, and it's all about developing and adopting clear strategies for physical and mental self-care and self-awareness. And again, I think we know this, to maintain a high standard of professional effectiveness and safe working environment. So we've got to take proactive steps, and it really clarifies our stance on mental health. I think that's really important. And we know as registrants, and we know as members of the public, that it's entirely possible to practice safely and effectively if you have a mental health condition, a single episode, ongoing or repeated episodes. So we don't, if we need to seek assistance from our employer, and we're going to hear from an employer later, it doesn't mean that our employer needs to refer us to fitness to practice, or that we need to let the HCPC know if we're in that situation. What we need to think about is what we can do in that situation to maintain our own health and well-being and to deal with that issue as that's come up for us. And we've got a fantastic flowchart I'm going to cover in a minute in our health and character guidance that gives us some really clear advice in this situation. So I'm actually going to look at that in a bit. But if you're an employer on the call, it's also important to think about your responsibilities to provide a working environment in which these standards can be met. All right. If you don't feel you've got the adequate time, support or facilities to do that, to help registrants maintain the emotional burden of their workload, then actually you can use our standards to sort of try and generate and try and make improvements in your support. So it can drive change. Okay. So what about these myths? We talked about them earlier, didn't we? So one of these myths, as I said to you, is about the fact as registrants, we're all a bit worried that if we were called for a CPD audit, we'd have to prove that we've done and we've met all the updated standards. Now, our CPD guidance is really clear here, and this is what it says. It says you'll need to ensure, that you're able to meet the updated standards insofar as they are relevant to your scope of practice. And I put that in red because I think it's really important. Our scope of practice is super important. And it's not a requirement of the HCPC that registrants conduct CPD that meets every one of the standards of proficiency. We rely on you as registrants using your professional judgment to decide how to focus those CPD activities to best improve your practice in relation to benefiting service users. So that's what we ask of you. All right, so I think that's really important to make that really clear. And the other myth that I mentioned a little bit earlier is one that I think is a really common one. And we are very concerned here at the HCPC about things like people self-referring to the HCPC when actually it's unnecessary. So I'm feeling anxious and impressed. Do I need to self-refer to the HCPC? So last year we did a webinar devoting a whole hour looking at this area. So I urge you, if you are worried about this particular issue, do go back and have a look at that webinar, and we will drop the link to that in the follow-up email. But I think just to clarify, I think it's really important, our health and character guidance was actually updated a couple of years ago now, has an absolutely fantastic flowchart. And I think this really helps. So, it doesn't contain a list of health conditions because that's not actually the issue. The focus should be on the impact of those health conditions on the ability of registrants to practice safely and effectively, as opposed to the diagnosis. So you can use our flowchart, and there it is there in our health and character guidance. And we ask you 3 questions to help you make a judgment about whether you, or if you're an employee, looks at supporting your registrants to practice safely and effectively. So all individual registrants' circumstances are all different. So you need to ask yourself, is the registrant, or are you, able to manage their condition so it doesn't impact on your ability to practice safely and effectively? So could it be managed through medication or treatment, for example? Can you adapt, limit, or change your practice so that again you can practice safely and effectively? Can you make any reasonable adjustments in the workplace that again will enable you to practice safely and effectively? So this is really important, because if you did have an acute episode of illness, you might need to take some time off, and that would be you adapting, limiting, or changing your practice, all right, to be able to practice safely and effectively. You're recognising that within yourself. So I think our health and character guidance is super important, here, and I think that's really important. So I'm just going to pause. Fiona, are there any questions coming up here?
A question had come in, Kim, in advance of the webinar around that I thought would be quite useful to address. In fact, 2 questions had come in that were very similar. So if it's okay, we could address that now. So that question was particularly from employers. So 2 employers got in touch to say that they were managing, employees, one of whom had come to them recently experiencing a very acute episode of anxiety and depression. And the question they had raised with us is, do I need to refer them to the HCPC? I wonder if you might be able to answer that at this moment in time.
Yeah, I think it's really important, exactly what we've been talking about, Fiona, isn't it? I think firstly, to have an employee, a registrant, come and talk to you about their health concerns is actually a real compliment, and you should feel very, congratulate yourself that you've got that open, transparent relationship. And I think it's perfectly okay for registrants to work with anxiety and depression if they are looking at those 3 questions and thinking about reasonable adjustments, thinking about limiting or adapting their working practices. And you as an employer can actually reassure them by having that flowchart open and saying, let's go through these questions, let's look at these together and look at the reassurance that they bring for you. So having those supportive conversations, I think, is super important. And thinking about also contacting professional bodies, getting support. And I know later on I'm going to hold that thought because Justin's going to come back to that in a minute and talk about what the support that employers have. Our employee hub has some really good information as well about how to support registrants, so I hope that's really useful. Thanks, Fiona. So I'm going to move on to the next part, really, which is support from ourselves, our employers and others. And I'm actually going to pass over initially to Laurence Gamlen, who is the Staff Wellbeing Lead and Pastoral Care Lead at Ashford St Peter's NHS Foundation Trust. And Laurence is Laurence and I met at the beginning of COVID, and Laurence provided me with some strategies that I used quite a lot when I was redeployed during COVID. We met in our first week and he taught me some really important points. One of those was standing if I felt completely out of control and very, very stressed, and I did use this many times, was standing with my feet on the ground and grounding myself, pausing for just a second, looking out of the window and sort of just thinking the world out there is actually still carrying on, and thinking about that. And it really helped me. So I invited Laurence to share with you the tips that he gave me. So over to you, Laurence, if that's okay. I know you're going to share a wonderful slide called apples.
Thanks very much, Kim. It's very good to be a part of this seminar. Thank you for inviting me. When I started with my trust, the Ashford St Peter's Trust, back in January 2017, it was for pastoral and spiritual care of patients. I soon discovered that I was spending far more time with our staff team, listening to them as things were happening. And then we rushed into COVID, and I was fighting a few fires and trying to keep our staff through the pandemic. I'm really grateful to Anxiety UK for being able to nick their slides and adapt them a little bit for this presentation. It's apples, basically, and I just briefly want to go through what each of those letters stands for. And the first is simply to acknowledge when we're going through a tough time, we tend to carry on until we fall over, and that's not helpful to anybody. So good well-being starts in our head. Okay, we have to be thoughtful about these things, and the responsibility for our well-being sits squarely with us. Employers can help, but we've got to take the first step, and the first step is to acknowledge that this is tough. I am feeling anxious, whatever it might be. And notice where that's happening. Our bodies are really helpful to us in this acknowledgement. If we're feeling headachy, if we're feeling tense in our neck, calves, whatever it is, then let's listen to those telltale signs and give ourselves a bit of a break. Acknowledge the uncomfortable feelings that are going on for you that come with being anxious or a little bit out of control. We love being in control and we hate it when we're not. The second thing is about pausing. And I'm so pleased, Kim, to have your testimony that it worked okay for you to pause. Again, we need to stop doing things. What we tend to do in healthcare is to go on a sort of autopilot. I don't know about you, but if I drive myself to work, familiar roads, familiar vehicle, turn up in my familiar destination, and if I was to stop and think when I arrived, how the hell did I get here just now? I wouldn't be able to answer myself because it's been an autopilot thing. And we do that in healthcare. We operate on autopilot. So when things are getting a little bit hard for us, turn off the autopilot, switch it off. One of the examples you can test yourself with, whether you're operating on autopilot or not, is when somebody passes you in the corridor, you greet them with those words, "Hi, how you doing?" And they say, "Fine, thanks, you." And you reply, "Fine, thanks," and you walk on. Nothing's happened there except a rather autopilot response. So if you find yourself doing that, then it might just be a little message to yourself that you need to just stop, take a feelings check. How am I? And use the prompt of the other person. If they're asking you, how are you doing today? Stop, pause, answer them. Not fine, thanks you. Okay, so that's the pausing bit. If we're pulling back, that's the whole helicopter view, if you like. What happens is we have a situation which might be that last straw for us, and it's likely to tip us over to a place where we don't really want to go. So we paused, we've acknowledged. Next thing is to pull back. If I was sat in front of you at the moment, I would have my hand right in front of my face, and I would visualize what the thing is which is causing me grief and stress at the moment. And I would then move my hand away from my face so that my hand is smaller. Now, I know that's a bit of a mind thing, but actually, when you're the thing which is written on your hand, right close up to your face, you can't see anything past it. Push it away, it's in your head, push it away, it becomes smaller. And you can also take in a bigger view as well. It's a helicopter view, if you like. And the things that we notice when we take in that bigger view is that actually we're not complete numpties. Despite what we might be telling ourselves and what that little parrot might be saying to us on our shoulders, we've been here before. I've got competence, I've got training, I've got experience. So again, good well-being starts in our heads. We need to remind ourselves of those realities for us, what's true for us. That's what the pulling back does. It takes away from us the thing which is clouding our vision and preoccupying our vision, and it allows us to see things behind. What we see behind is really helpful stuff. Next thing is to let go. Let go. Okay, so if we've had a situation and it's left us feeling a little bit anxious, feeling that we're not very good at what we do, it's happened. Okay, it's not going to happen again. It's in your past. So just recognize that. It's not going to trip me up again. I've had that intervention with that colleague or that patient or whoever it is. It's happened. I need to let it go. So I need to be thoughtful about that again. Unhelpful thoughts and feelings, they will pass, but sometimes they need a little help. And again, I want to offer you a little mind game. Consider the situation as if it's in the palm of your hand. And what you might want to do is blow it away. Watch it float away. Maybe you might want to sort of visualize putting it in a box, putting some tape over it and placing it somewhere else. We can come back to that another time when I'm ready for it. But at the moment, I'm just letting that go. When we let that go, it gives us the space to focus upon what we have control over and not be concerned about those things we don't. And when we stop to think about what we have control over, the only thing we have control over is ourselves and our response to what's going on, to the various things that are happening to us. So focus on what we have control over and let the other stuff go. And I know this is so much easier said than done, but like anything else, you practice and you do it. I want to talk about the E, explore. Just in this moment, right now, it's okay. Check in with yourself. Actually, you're alive and kicking. You're still breathing. And breathing is really important because the best first aid we can do for ourselves is to turn off the autopilot when it comes to breathing and actually be thoughtful about our breathing. I talk about taking 60 seconds every 60 minutes to take 3 long, deep breaths. It regulates ourselves. And while you're doing that, do what Kim did. Look out the window. Put your feet firmly on the floor. Actually, just stamp on the floor a bit. It's firm. It's not going to let you go. And if you've got a window, I don't have a window in my office, but if you did have a window, well, just take a stroll out and have a look at what's going on. It's great for birdsong this time of year. Just listen, explore, because right now, it's okay. It's okay. And lastly, support. You're not alone in this. You really are not alone. Your colleagues, those you work with, they are very, very likely to be feeling exactly the same sorts of things that you are in terms of their emotions and their thoughts. So let's look out for one another. Let's be kind to one another. And we are always better together. I do want to say a quick word about WhatsApp groups, if I may. WhatsApp groups, aren't they brilliant? Except when they're not. They're not when somebody in one of your groups goes a bit rogue and starts putting up text and messages which actually don't do anything good for you. You know, you can't control the sender of that message, but you can control your response to it. So just mute yourself, come away from the group for a bit. If it's not helpful to you, you don't have to put yourself in the firing line for it. And my last point, it's all to do with that support thing. I do have a little bugbear about the fine thanks you response. I wish I could sack it. So next time somebody asks, how are you doing? And it's the British thing to do. That's great, because we do it a lot with one another. How are you? We say. Well, acknowledge, pause, pull back. Actually, I'm feeling a bit, whatever it is you're feeling. It'll do 2 things. It'll really freak out the person who's asked you the question, but it also gives them the opportunity to develop a little bit of a meaningful conversation.
Thank you ever so much. Thanks ever so much. They're lovely tips, Laurence. As you know, they meant a lot to me. So thank you for that. Brilliant. Appreciated. So we're going to actually hear from Justin as well, who's going to give a few minutes sort of from the employer. Now we've asked Justin, who is a specialist lecturer, as you see, Wellbeing and Inclusion at East of England, and we've asked Justin specifically to look at, we know that lots of employers have lots of information. So he's going to just give you a quick 5-minute glimpse into what the East have, just to give us an example, because we know that your employers will have lots of information as well. So I'll let you over to you, Justin, if that's okay.
Oh, good afternoon, Kim. Thanks very much for the invitation, and absolutely delighted to be able to showcase what we do at East of England Ambulance Service and what I do within my role in the Directorate of Culture, Strategy and Education, and what we teach our students about how they can look after themselves and the support that we've got available from our fantastic trust. And I just want to start off, if I can, with the mental health continuum. This was developed by the College of Paramedics and the Association of Ambulance Chief Executives, which is known as ACE. And it's a real useful tool, which I think is really suitable for all registrants. And what it kind of illustrates is that our mental health and our well-being is effectively on a continuum where we can thrive, we can survive, we can struggle, and sometimes we can be in crisis. But the key is that you recognize what stage you are within the continuum and what steps that you can actually take to mitigate that, and how you could look after yourself and be proactive in your nature. And what we do as a trust, we take a proactive approach. We have a range of services that are available, and we encourage our people to access these services so we can support them with their needs. Next slide, please. And really, I just want to showcase some of the tools and referrals that we've got available within our organisation. And the employee assistance programme is really, really useful, and that's a 24-hour service that our people can contact. And what that allows is that they can have support for their mental health. It can cover things like their work and personal relationship problems, some legal advice. It offers family support, as well as those dealing with substance misuse, and some financial advice. And we have to widely recognise that for our people to support patients and to provide the best form of patient care, we have to look after our people, and these services kind of are there to support the individual, because collectively they can provide the best patient care if we're looking after them. And what the assistance program does is it's there to be available at that person's time of need, and that they can be proactive and can access it and get the right level of support. And it's also confidential, and I think that's key, that they can get needs for their personal lives, and we can support them as much as possible. We've got the TRIM referral service. Now, this is for our people who may be affected by trauma and maybe showing signs initially of post-traumatic stress. And if this is identified, our people can be referred through the TRIM referral service, and it's a peer-led programme. And I think it's really, really beneficial to recognise something quite early on and put support measures in place. We have got an emergency crisis line in conjunction with Task, the ambulance charity. So if our people are really struggling, this is a 24-hour service that is available that can support them. We've also got a spiritual and pastoral service with an excellent team of chaplains of multi-faiths, and they support our people and provide emotional support and spiritual guidance at their time of need. We've also got a blood and splash and needle stick advice line, because we recognise that quite widely, if that happens, it's a really distressing experience, and you want advice and support, and I think it's fantastic we've got it. We've also got a mental health hub that's available through different parts of the trust, and that's in conjunction with other parts of the NHS, and this offers our people different levels of support that's specific to their needs. The trust also provides every member of our staff, free of charge, a subscription to the Headspace app. Highly recommend it. It's a fantastic resource which gives tips, it gives lessons, it gives meditation sessions, it helps with sleep, managing stress, mindfulness, healthy eating. It's also about resilience, and it's a supportive package that they can access 24 hours a day, and it's in line with this proactive approach about your mental health, that this is available, and I think it's brilliant the trust provide this free of charge. And next slide, please. We've also got a fantastic staff support network across the trust, and these support networks offer support to people who may identify in any of these networks, and it's available, it's peer-led, and it offers a fantastic range of support to our people, and I think it's brilliant that we have them. And I think quite widely the trust works collectively with multiple organisations. Task, the ambulance charity, are a fantastic organisation that offer a range of support to our wider green family. We've got the College of Paramedics who are doing fantastic initiatives such as the Wellbeing walks. They do yoga initiatives, and they're really pushing the agenda for frontline paramedics. And as the initiative is that not all paramedics wear green. Paramedics work in a variety of sectors, and the college are really pushing this and really showcasing the importance of mental health and well-being. And just to finish off, the Blue Light Together is a multi-emergency services initiative, and they offer a fantastic range of resources that's available free of charge, and again 24 hours a day. So just to summarise, we as a trust, we're very proactive in what we provide with our support to our people, and we encourage and educate everybody as they come through into our classrooms that if you need help, please don't be afraid to ask for it. The support is here. We want to look after you. Just let us know, and we will do everything that we can, because our people are our greatest assets. So thanks very much.
Thanks, Justin. And I think what we just wanted to showcase what one employer does to show that lots of employers do the same. This was just one example we chose. Thank you ever so much, Justin. I'm actually going to ask Carrie, Carrie to come online now. Carrie, if you don't mind. Now, Carrie and I met at a conference, and I was very inspired by her talk about the joy of work. And sometimes, like most people, I don't feel very joyful at work, and I'm sure that lots of people here don't either. if we're honest, but I wanted, Carrie made, again, those little tips and hints that all the speakers have been given to finding joy at work, and her few tips and hints made a real big impact with me. So Carrie, I'm going to ask you just to do the last bit, if that's all right, on your passion, which is finding joy at work. So thanks, Carrie, over to you.
Lovely, thanks so much for the invitation. So hello, my name is Carrie Biddle. I'm a speech and language therapist by profession, but I'm here this afternoon as an elf for all seasons. So I believe joy is for all year, not just for Christmas. And I started very much developing my elf-like self back in 2016-17, and really draw upon the evidence and information that came out of the Institute for Healthcare Improvement on the concept of joy in work. So the most joyful, productive, engaged staff feel both physically and psychologically safe. They appreciate the meaning and purpose of their work, have some choice and control over how they spend their time, and they experience camaraderie with others at work. So who are these happy, healthy, productive people? Well, Andy Cope and the Art of Brilliance describe the habits and behaviours of what they call the 2%ers. So these are 2% of people in the population that fall into the category of feeling consistently great. So you think about it in terms of a positive growth mindset, but they can stand out a mile. So when you're next at work or at home, look around and see if you can notice any of these habits and behaviours, and where you think you are. Are you in the 2%er club, or do you sit within that circle of comfort? These people are enthusiastic, they're optimistic, energetic and possess that can-do mentality. And it's about what they do as well as how they do it that makes a difference to their health and well-being. Next slide, please. So I'm really pleased to have pinched with pride a slide from was at the time third-year physiotherapy student Alex, who was on a placement with us from the University of West of England, who back in October 2021 actually chose to do a project focusing on self-care and what matters. And as part of that, he shared some strategies I use all the time with people, and having looked through the Slido, I can see they've come through. So the use of mindfulness is really important. Reflective writing or reflective running doesn't need to take a lot of time, but it's a practice and a habit that people can find useful to download some of that burden in their head and their heart at the end of the day or the end of the week. Interacting with nature, again, that's really come through strongly on the Slido, and that balance of physical activity, looking after your health and well-being in both the physical and mental state. So we need to focus and offer ourselves the same care and kindness that we would to another when we see others are struggling. And as health and care professionals, being caring and compassionate is often top of our list of values and behaviours that we use to shape our career choices. And we need to use those same skills and thoughts that we offer to others to ourselves sometimes. Next slide, please. So what does this look like in a team sense and that camaraderie at work? Well, appreciation is key. Paying attention to people, their energy, engagement, actions and behaviours, and the things that you want to encourage for people to share in the team takes time. Providing real-time positive motivational feedback in a daily sense helps. Appreciation is a gift to share with others, and it is people focused. So you have to take the time to notice the people, hear them, letting them know that what they have said or the actions they've taken mattered and are valued. So we talk about the appreciation high five. So is there 5 moments in the day where you can see it, say it, write it, share it with another person to let them know that they have been noticed and recognised in the day, and you've appreciated something they've done, something they've said, and action taken? Next slide, please. Other things, we often have lists. People like a to-do list at work, but actually how about how we feel or how we want to be at work? And sometimes the issue with a to-do list is that they're never ending. You scrub something off and you add another thing on. So how about thinking about a to-do list? So when was the last time at the start of a team meeting you've actually gone through and celebrated the things that you've achieved or the actions taken to make improvements or progress towards achieving things before you crack on with what needs to be done today? I'm going to pick up on Laurence's point again about how are you doing today? Actually, people will come back with it, I'm fine, thanks. If you swap that for how are you feeling today, you will catch people off guard, and actually you're asking them about them as a self, not the work to be done.
This slide sort of summarises the key points that we've actually looked at, that we now expect you to proactively manage your mental health, but that it's important for you to be able to practice safely and effectively. And it doesn't mean that you are not fit to practice merely because you've got a health condition. There were three things that stood out for me from all the speakers. First thing from Laurence, it was about the pausing. Of course it was. Justin, it was about the fact that there is support out there. It's just you've got to access it and look for it. And Carrie, for me, it was about appreciating and saying thank you. I'm actually going to ask, he's not prepared for this, so I do apologise, but Laurence, to come and give us our last thought for something we can all do together now to just enable us to ground ourselves in where we are right at this moment, Laurence.
I'd love to do it, yeah.
I know you would.
If I could invite you all, please, to make yourself as comfortable as you're able to do. Chair that is supporting you, and recognise that your chair is in fact supporting you. First thing I'd invite you to do is about 5 things see or notice around you. 5 things see or notice around you. Next thing I would invite you to do is think about 4 things you are feeling. 4 things. Next thing I would invite you to think 3 things that you can hear. 3 things that the next thing I would invite you to think about 2 things you can smell. 2 things you can smell. And lastly, 1 thing you can taste. 1 thing you can taste. Thank you, Kim. 1 thing to take away. How am I going to respond?
Thank you, Laurence. That was actually lovely, and I actually felt myself relaxed a little bit, even though I've been running a webinar, and it's just allowed me to reconnect with what's going on around me. So it's been a delight to be joined by so many of you today. I hope that you found it useful and you've also picked up some hints and tips. And I'd like a big thank you to my colleagues Laurence, Justin and Carrie for giving up your time as well and making the webinar just such an interesting time today. So thanks very much, everybody. Enjoy the rest of your day.